Hi, welcome to Pinnacle Hand Therapy. Today we're going to go inside and we're going to talk about physical agent modalities, also known as PAMs.
Today we're going to talk about whirlpool. The whirlpool is used mainly for wound care. What we have here is this part of it is the tub. And then of course, this is the motor that provides the aeration. We have a handle here because this is manual. Depending upon how tall your person is, it allows us to move it up, also for cleaning it. And then of course, for lowering it. What's really important is that there is a hole that actually evacuates the water once you're done with it. And here in the clinic, we typically have an extended hose that's used for actually running the whirlpool. When you release the water, there's actually a gadget here that is flipped on. And then, of course, when you need to utilize the aeration, there's a button here that helps you to turn it on. And so in just a moment, what we will do is we'll bring a patient in so that you can actually see what happens with regard to setting the temperature and what the aeration what the aeration looks like. Typically, the temperature should be somewhere between 104 and 111 degrees.
Typically, we ask the patient to touch the water before he or she puts their hand into the water for comfort. So I'm going to go ahead and ask Mr. Ross with his non-involved hand if he'll touch the water to see what it feels like. Is that comfortable? Okay, so he has approved. Now, I have a few things here with me. I have a hand towel or face towel. We usually use this so that we can get rid of some of the old skin, but I always like to place a towel over the patient's lap, because what we do is we set the timer at 10 minutes and 5 minutes. I ask the patient to hold their arm up out of the water. What this does is it takes them out of the dependent position that would cause swelling. All right, so we have this pool noodle here just to make sure that his hand is comfortable. I always like to turn on the aeration and then let them submerge their hand into it. The reason that I do that is because they can choose exactly where they want to place their hand for comfort. And remember, at 5 minutes, you're just going to bring your arm up out of the water and count to 10 slowly. So go ahead and place your arm. Let me turn it on. Place your arm in. Good. And start the clock. Okay, and then remember, you're just going to bring your arm up. Go ahead and bring it up just to show me. Good. And back in. All right.